robust.
This conference will now be recorded.
So we can address all the items. Okay, so the first thing we're going to do, I'm gonna make sure, I'm gonna do a roll call to see if we, the PHAB members are here. Is Barbara Juarez here? Barry Buchanan? Barry? I thought I saw Barry.
Here.
Okay, awesome. Leah, I thought I saw Leah. Did I see Leah? Was I just, okay, I don't see Leah, okay. Lee, see Lee? Dr.
Yeah,
Seeley?
I'm here. Yep.
Okay. Lindsay Karras, Lindsay, are you here? Yep, I saw you. Sterling Chick, Steve Bennett. So I think we have a quorum. Am I right, Tammy?
Yes, that's correct.
Okay, so I'm going to call the meeting to order, and I'm just going to remind everyone to put your devices on mute to cut down on the background noises. And throughout the meeting, if you have, if you would like to speak, please put your name in the chat box so that I know to call on you to speak, so that not everyone is speaking all at once. And the public comments were asked to put it in the via email, and I think Tammy will be taking care of that. And any media representative, for any questions or comments, please contact Joint Information Center for your questions. And I believe Tammy will also put the email address in the chat box as well. And as we are going through each discussions, I just ask that we wait until the presenter is finished before we go into discussion. And again, let's put the names on the chat box so that we can do it in an organized fashion. Okay, so the first thing to address this morning is the approval of the minutes. So I am assuming that everybody had a chance to go over the minutes. And so I need a motion for the record.
We'll move that we approve the meeting the meeting notes.
Okay.
I'll second.
Do I have great. Is there any further discussions or any recommended changes to the motion? Okay. I take that as a no discussion for right now. So I am going to just go down and ask everyone individually to see if you approve. Lee, do you approve? Okay. Sterling? Okay. Lindsay? Okay. Barry? Okay. And Steve? Okay. And I will also vote yay. So
Leah's
did I
here.
miss anybody?
Leah. This is
Leah.
Sterling. Yeah.
Oh, hi Sterling. Where is Leah? I'm not seeing Leah. Okay, Leah, can you vote for the minute? Oh, hi Leah, there you are. Good morning. So Leah is present this morning as well. Good morning, thank you. Welcome to the meeting. And we're just going through the voting for the minute from the last meeting. I assume that you had a chance to look at it. So we are asking for votes. So yay or nay, Leah? Okay, awesome. Great. Okay. So the motion has passed. Tammy, am I missing anyone else at this point?
No, you're good to go.
Okay, awesome. So the second item on the agenda is the COVID-19 response update from our new and beloved Erica Lockenbach.
Thank you, Tina.
Can I interrupt before we go? That some people may not know that we're not going to get to all the items on the
Yes. Okay. So thank you for reminding me, Sterling. So we have very robust agenda. So what I have sort of kind of executive decided is that all of those items that we have listed are very important. But I don't want to minimize any of these issues by not giving it enough time. And so items 5, 6, and 7, we're going to have a separate meeting in a couple of weeks to address those 3 issues together in a separate meeting. And this morning we may just say a 1 or 2 words about them, but I want to give enough time for the other 3 items to have enough time to have a presenters present as much as they need to and have a discussion about it. And so I just want you guys to know we will give it like maybe 2 minutes to just kind of, mention 5, 6, and 7, but we're going to table that for a special separate meeting. So we do need to come up with a separate time for that meeting, but today we're not going to discuss 5, 6, and 7. So we're only going to items number 4. Okay, does that make sense? Okay, Erica, floor is yours.
Okay. Good morning, everyone. Leah, we haven't met in person, so hello. Nice to see you. I had trouble writing the discussion form in a way that wouldn't make it obsolete by the time you all met, because I did write it about 2 weeks ago, and things are changing really rapidly. But I just want to give you a little bit of an update on where we are right now for those of you that don't know. And I'm just pulling up my document that shares a little more information. So I mentioned that I would give you some updates on the key metrics for COVID. We, as many of you know, are exceeding our average cases in order to move to phase 3. And forgive me if I'm jumping too far ahead. I'm assuming all of you read the staff report and have some baseline knowledge of what's going on. But if you don't, I'm happy to jump back and talk about that too. So we're exceeding our 4 average cases per day in order to move to phase 3. We're at 11.6 as of a couple of days ago. So we're pretty far off the mark on that. There have been a lot of cases in the last couple of weeks. And in fact, last week was our worst week on record in terms of number of cases. So it is disheartening that we feel as though a lot of the work that we have done and our community has done resulted in short-term gains in terms of reduced cases, but we are seeing those numbers coming back, and that's obviously very concerning. We have seen, and this has been really interesting, about 2 months ago when we looked at these numbers in April, about 3/4 of the cases we were experiencing in Whatcom County were among people 30 and older, and pretty heavily skewed to 60+, given that was the time when we were really struggling with the long-term care and congregate facility outbreaks and lots of cases there. And in contrast, in the month of June thus far, we've seen an almost complete flip, and now 2/3 of cases in Whatcom County are people 29 and younger, and more particularly in the last couple of weeks, we've seen a pretty sharp spike of people 19 or younger. And this is due in large part to social events and activities. We've seen a number of cases associated with particular large social events or parties. I shared last week that there was one particular party with about 150 people, and that resulted in 29 positive cases and 31 employers that were impacted by that one social event. So the other challenge that we're having is as people continue to move about and have, as we've seen with younger people, have less severe symptoms, They are going to work sick, they're visiting with family and friends sick, and they're going to more social events and parties sick, either with very minor symptoms or pre-symptomatic. So the opportunity for one particular person to expose even up to 50 people is there in some of these situations. Whereas when we were still in stay home, stay healthy, you would generally see a much smaller range of exposure, just given that people weren't going to work, they weren't going to social events as much, they weren't going to stores and restaurants and all of those kinds of things. So so we are seeing that that's I sort of talk about the web. The web continues to grow as we have more and more context associated with each case. So the other thing to share, just in terms of our current state, is I mentioned there were 31 employers impacted by that one particular party, but we have seen 20 outbreaks that meet that DOH definition, which is two cases within 2 weeks, or in a congregate living facility, a single case would constitute the definition of an outbreak. And we've seen 20 of those in the month of June, and about 57 cases associated with those recent outbreaks, and 31 probable cases. So these are still there are still lots of clusters and ways that we're seeing how people are moving about and infecting people that they work with, socialize with, live with, etc. So so it's a continued challenge. Our priorities at the health department are continuing to do case and contact investigations and ensuring that people have the supports necessary in order to effectively isolate or quarantine either at home or connect them with the county's isolation and quarantine facility. We are also working with our care providers to ensure that that testing is available for those who need it. We are working with WHATCOM Unified to plan for additional surge capacity, and actually the state surge team is here today meeting with WHATCOM Unified and some of my colleagues to talk about what that might look like if we do have a surge in cases or a surge in need for medical care. And then of course we've always said that we have both a disease crisis and a communications crisis. And although we've seen sort of the dips and peaks in cases and in concern and panic and urgency, there has been a steady stream of need for communication. And so we continue to try to find new and different ways to communicate with people. And most significantly right now, we recognize that traditional media outlets are not reaching, especially that 19 and under age range that are probably not listening to KGMI or reading the Bellingham Herald. So we really have to be more creative and think about how we can reach those audiences. I will, of course, we're going to talk about the PHAB task force, but that's been a big focus of a lot of our staff time in subject matter expertise in working with businesses when there are outbreaks, and just so providing support and services for employers pre-outbreak and post-outbreak. So so we've been sort of doing a number of things in that area. And I just if you looked at our org chart 5 months ago, it would look nothing like what it looks like now. And I just want to highlight the incredible work the staff are doing. We have someone whose day job is to inspect septic systems that's doing communications work. We have restaurant inspectors that are doing case and contact investigations. It is amazing how many people are involved in this and are doing and taking on new and different roles that they've never had before. Nearly 80% of our staff are involved in either full-time or at least part of their time in the response. And so it's just a really incredible effort. Cindy and Astrid, I see Astrid's on the call, have I wish we had one of those celebrity mashup names like Sastrid or something, because they are the incredible team that are managing all of the case and contact investigations, all of the testing capacity. They are just, the two of them together are doing absolutely incredible work. John is our contact with WHATCOM Unified, is helping us with our operational planning and ensuring that connection and link between our work and WHATCOM Unified, which is incredibly critical, and has been so successful in getting grants from the state and federal government for COVID-related support, especially for homeless and low-income populations, that she is spending a lot of her time really just trying to get money out into the community so we can respond, and also continuing to work on the triage facility. So she's been doing really incredible work as well. And Kathleen, who will be talking this morning, is leading us in our biennial budget process, which is an incredible amount of work. And this is her first biennial budget. And I just really want to say thank you so much to the team. And of course, my either I'm his sidekick or he's my sidekick, but Greg Stern and I talk about 2 hours every day and about everything that's going on in policy decisions. And we just, our team is really strong. The staff have really pulled together and really do believe that this is, we're in this together. We are working really hard, and it's just been a wonderful experience. I think that's the bright shining light in this work. People are tired, they're burned out, they're struggling, but they recognize the need to show up, to put on their best face, to work hard and get the work done, because we just feel really compelled to help our community to lead this response and try to get us out of this as quickly as possible and as safely as possible. So with that, if you have questions, I know we just had a few minutes for this topic, but if you have questions, I'm happy to answer them.
I just wanted to, if I raise my hand, I can just go. Okay. I just wanted to acknowledge all of the work that the health department has done. And also I wanted just to verbalize, as someone in public health, and how much I appreciate the variety and holistic activities that y'all are doing. I think you see a lot of health departments across the nation that are focusing on just one thing, and they put all of their eggs in that basket. And I think that sometimes that's a short range goal. So for instance, testing or anything like that, if that's all their health department is doing. And I really appreciate how much this health department is looking at the long game, looking at the communications, looking at population support, looking at employer support, looking at testing, and really taking an aggressive, multifaceted approach to things. So thank you for your leadership.
Thanks, Steve.
Anyone else for any other comments? Well, I'll just make one quick one. I think COVID, this coronavirus pandemic, is brand new, and it's difficult for all of us. And I think that Erica and Astrid and Cindy and Greg are doing a phenomenal job, because information changes almost on daily basis. Things that we knew yesterday may not be true today. And this constant evolution of not just what we understand, our information about the virus, but how it behaves within our population, and the response of our own population, has a lot of influence, with the whole picture of what we're dealing with. And I think the difficulty of that is underscored. And so again, I just want to express my appreciation for the difficult work that you guys are doing, and I just want you guys to feel supported. And this is, we're all in this together, and you guys are kind of taking the hits for all of us, trying to navigate for us, as well as trying to take care of, all of us, our community. So just want to put that out there.
Gina, you're on mute. Somehow you got on mute.
No,
Gina?
I was just, yeah, I was just trying to make sure that I wasn't seeing anybody's name pop up saying that they wanted to speak, that I was ignoring, because I said that's what I was gonna do, and I think we're doing okay, just kind of popping in and chiming in when we want to speak. So that seems like it's working. So do we want to have any other discussion about what Erica is talking about? Greg, Astrid, do you guys want to add anything else to that? Go ahead, Greg.
I'll try to keep this really brief. One of the biggest factors we're facing is we have a lot of guidance. The public health has a lot of recommendations, guidance. These are the things that work to stop virus suppression. We try to do this by informing and influencing. We're trying to engage people together to help keep our community safe and our economy sustained during a pandemic. And so often the dialogue is about, what do we have to do? What are you making us do? It's about control and fighting control. And we have these tools that really depend on engagement and people doing it, both in terms of workplace safety, social interactions that keep things safe. And there is very clear resistance to those measures. I think people are tending to listen to their leaders. And when they have leaders of the resistance to public health measures, it's really hard to just say, to go to people with information and advice and recommendations. They look at the same numbers and come to different conclusions. So this is a big challenge for us in terms of engaging people in helping us with contact tracing, with isolating themselves, quarantining in order to stop spread. And it's something that as a health department by ourselves, we can't do it. We really depend a whole of community as well as whole of government response to it. So in addition to testing, tracing, doing isolating and quarantine, giving people advice, we really need help in shifting culture so that we really get to that thing of it's all of us together to stop this slow transmission, to keep our health care system functioning. We can give the advice. We really are trying to engage people in, how do you implement that? What are the barriers? How can we share information to be able to make it happen as opposed to just fight control? And I think that kind of leads into the discussion about the business work task force. But I just want to encourage you guys to be thinking not so much what can the health department do, but what can we as a community do to implement all these things, the few things we know that actually work.
Yeah, that's a really, really good point. It seems like at this point of facing this pandemic, not everyone is looking at the situation with the same lens. We can talk about different philosophy and and all of that, and I don't think it's this is the right place for that. But we do have to do our job to spread the right culture onto those that we influence, so that so that, you know, Greg and Astrid and Erica and, you know, Cindy and you know, and John can do their job and their message actually gets across and be effective, not just heard, but be able to implement so that those measures get carried out, and then we can fight this virus together. You know, I feel like this is World War III. You know, our enemy is a virus. So, and I kind of sometimes wish like people would understand that like we're fighting this common enemy together, and unless we're together, it's going to be a, you know, longer road, harder road. But are there any other discussions about?
Sheena,
Yes, yes, go
yeah,
ahead, Greg.
I just wanted to add, you know, how much I appreciate the perseverance and the flexibility and the nimbleness that the health department has shown throughout this crisis. This is certainly not a sprint; it's definitely a marathon, and we have a ways to go. And I just want to say that I have appreciated your leadership, Erica, so much in this department. I think you've really you took it over at a really challenging time, and you just really have rose to the occasion. So thank you very much, and thanks to everybody. John, you've been working on this since day one, and I know it's been a long road, but we're still got a ways to go. But I really appreciate everybody and all the work you're doing. Thank you.
Okay, so are we okay with the discussion about the COVID? Okay, Leah, you haven't spoken up today. Anything you want to say?
I would only echo the words that were already spoken this morning, that I think public health is the sort of silent hero in this fight, and does not get as much recognition, but really is the thread that is holding our community together during such times. So I really appreciate your efforts and want to let you know. And completely understand that there is community fatigue about this effort. But really, we have to persevere, and I really, the part about sort of communication really resonates with me, and that we can, through our own individual networks, sort of continue to spread that word.
Thanks, Leah. Lindsay, do you have anything that you'd like to share?
No, just again, echoing everything, really in deep gratitude to everyone who is doing work on the ground, both in the community and in the health department. So thank you.
Okay. I think then we're ready to go on to the next topic, the COVID-19 Employer Support Task Force update and presentation. Tammy, are we okay to go on? Do you have the slides ready? Holly, are you ready?
We're okay to go on. I've made Holly presenter.
Okay. So before Holly gets on, I just want to, sorry, hang on. I'm just trying to. Sorry, guys, hang on. Okay. All right. So I just wanted to say just a couple of things. About the COVID Employer Support Task Force. So, you know, this task force was created back in late May, and the goal of the task force was to help our community businesses and organizations to innovate and improve best practices for safety. And it's been a pretty intense process. I'm echoing, aren't I? Okay, I'm gonna try and do something. Am I still echoing, guys? Okay, awesome. And so it's been a pretty intense process, very complex, and I have to say, the facilitators that we have, Holly, Laura, Marty, they've been amazing, shepherding us through this. And I'm not going to go into, I'm going to let Holly kind of start the presentation, but we had 144 people who signed up to be members, and then we had to kind of decide, you know, how we were going to manage. And you know, Holly came up, not Holly, but you know, everyone, we came up with like 18 sectors, and then you know, dividing who's going to do what, and it's from where we were back in May to now, which has been, you know, barely over a month, and we've gone so far from where we were. But I'm going to hand it over to Holly so that she can continue the presentation. But it's been a pretty amazing process.
Great. Thanks, Gina. So hello, everybody. Nice to see you. And Tammy, of course, it's right now that my computer is saying I have to update everything to be able to share the presentation. So if you can run the presentation, that would be great. Is that possible?
I just have to find it.
Okay, it's the last email I sent you this morning. It says correct PowerPoint. And for those of you who don't know me, I think there's a couple staff people whose names I don't recognize, and then Leah. Hi, I'm Holly O'Neill. Nice to see you. And I'm here today with my co-facilitators. So we have Laura Todd, who you all know, who does a lot of facilitation for the health department, and Marty Solomon, my colleague, who works with me on all these different processes for community and public engagement on behalf of the health department for many years. We worked on the Child and Family Action Plan and the Health Protection for Immigrant Families and the Criminal Justice and Public Safety. That was with Barry and the council. So this project is, of course, I would say the most complicated project we have ever done, just as we're all facing all the twists and turns of the pandemic. And I want to start really by just doing a shout out to the subcommittee who's been meeting every week to help provide guidance and such creative thinking to this process, and also to the staff. So, you know, all of this is not possible, as Erica mentioned, without the dedication and the excellence of our staff. So especially I just want to give a shout out to Melissa Moran, our communications director, and her team, and also Darren, and all of the subject matter experts, because it's been a heavy lift for them to both provide information that we need, but also to be, you know, being pulled back and forth to having to do response to outbreaks. I mean, it's been a challenge. So here we are today, and I'm going to give a little presentation about where we're at with this process, and my subcommittee folks are going to pipe in at different points, and we'll just move right along. So can everybody see the presentation? And it looks to me on my screen like I can see the sidebar and then the show. Is that what it looks like to everybody else?
It's updated on mine now, so I see the full screen.
We see the show now.
Yeah.
You see the show? Great. I'm seeing the sidebars. Oh, there's the show. Okay. All righty. So here we go. So I'll just go bing when it's time to change slides. How about that? Bing. Here we are. Task force purpose. I wonder if I've got a lag. So we set this task force up to help our communities, businesses, and organizations share, innovate, and improve best practices for safety in the face of COVID-19 now and in the future. So if you want, you could think of this really as a method of both being in response to COVID, but also building resilience, because we know this is not just like a flash in the pan. This is going to be a thing we're going to be dealing with for a while. And one thing we discovered from the very first moment we rolled it out to the public, or to our task force members, is this anxiety that this was a regulatory process. And so, to be clear, and I think we've succeeded in communicating that this is not a regulatory process. It is about people coming together to help each other be safe. So that, I think that has effectively been incorporated in everybody's thinking, and overall has been just, the whole process has been so generative of a positive contribution and collaboration. And so that's one thing that's been really exciting through the whole process. Bing, next slide. So we had, this is our task force. We had, I think 100, and we started with maybe 140, and we're at 139 members. So everybody who applied to be on the task force was accepted, and we were then dividing them into 18 sectors. So this has been quite a massive engagement process with all of these folks. Bing. And from the beginning, we set up this task force action schedule, and the subcommittee helped with this, of just thinking through the steps. So we got everybody set up, did some presentations, and we're down here. I don't know how well you can see the screen, but after all of these meetings that we've had with the different task force members in sectors, et cetera, we're at the point of pulling together these guidance sheets, and Marty's been working really hard on that. And it's very difficult, because there's some things that are the same for everybody, some things that are very unique for different sectors. And so this has been a lot trickier, as you can imagine, from Melissa Morin and side of the world. This, when the information changes so quickly, and it's so complex, trying to get it down into simple forms that we can easily communicate has really been a challenge. Bing. Next slide. And this whole time we've been understanding, we knew from the get-go that this would be an iterative process. And I think on our very first presentation, I said, so just remember, mistakes will be made. There is no way that this is not going to be a learning experience for all of us. So I want to start by just talking about sort of what we've done and what we've learned. So we launched in mid-May. We surveyed all the members, these 139 folks. We identified liaisons for each sector to help provide internal leadership. We hosted the webinars and trainings. We created this monster of a comprehensive Google site for everybody to share information and for us to share information with them. And we provided weekly updates to the whole task force, and then FAQs. So as important questions emerge, we've just been able to answer them really on a regular basis, as clearly as we can. Next slide. And so here's a little bit about what we have figured out. So we knew from early conversations and our surveys that people, yes, indeed, they need clear, straightforward guidance that they can understand and rely on. In the early surveys, it became clear that a lot of people were struggling with even understanding what the guidance was. And then they also were having significant challenges with implementation. So these numbers, if I was going to guess, I won't give you an accurate number, but 60 to 70% are like, I'm having trouble understanding, I'm having trouble implementing. So we knew that, and these are people, if you got to think about this, the task force people are actually the ones who came to the table really with a lot more, how do I put this, more, they're the ones who are paying attention. So we know that if they're having that experience, it is probably true that most people in our community, most businesses are having that experience. And the other thing we realized is we needed to support businesses in responding to the different phases of the pandemic. So one thing that a model that Erica has said to me that that I think is apt here is that the response is like a dial, like we dial up, we dial back. So it's not only that we have to help people dial up, but we have to build a system in which they can also dial back if they need to, or dial a little bit differently because things have changed. So that's what we came into this process understanding. Next slide. So what we learned is that businesses throughout this process, that the people who showed up on the task force really wanted to partner and support each other in creating a culture of health and safety. Every call that we start, where we have asked, what is it that you want to contribute? And everybody's like, I want to help others. I want to help my colleagues, my professional associates, and our community to try and respond effectively and safely to the pandemic. And what we have found that we are really seeing this increase in community commitment and empowerment as our task force members now start to reach into their own communities. Next slide. So in terms of like, if our goal was community empowerment, I think we're doing a good job there. So we did these peer-to-peer sessions, and in each peer-to-peer session, so remember we have 18 sectors. Each one has the sector liaison, so a couple people from each sector who are providing leadership, members of the task force who are involved in that sector, the health department subject matter expert, that's Darren's team, who've been pulled from all over the health department, who are amazing. And we've had a PHAB representative, and then Marty and Laura and I taking turns helping with facilitation and note-taking. Next slide. So this is the outcome. Remember I said that it was an iterative process. So in the beginning we thought, oh, we will come up with some guidance sheets and that will make life better for everybody. But really, what we have come to understand when we respond to the needs that we are hearing is that the guidance sheets certainly are they'll be a helpful tool, and we're going to have more than that. But really what we're creating is a system. And these are the components of the system as we understand them right now. And we've started to call them WHATCOM Together as sort of the body of work that is coming out of the task force. So it includes 3 components. This network of peer support, which is not just the task force, but if you think of it going on and people wanting to continue to help. The campaign that's emerging, which we're going to talk about in a moment. And then really a robust system online on the health department website that has resources and guidance sheets and FAQs and tips and templates. So if you imagine that one of the things we are trying to do is really establish the health department as the go-to resource where you can go and you can get what you need, and you know it will be accurate, and you know that it will be the most up-to-date, and it will have stuff materials that are very user friendly. So we're evolving this web page, this aspect of the site to just really be customer focused. And that's been a goal for the health department always, is how do we make this really responsive to what we're hearing people need? So these are the 3 components that are this body of work that's coming out of the task force, inspired by and driven by so much creative thinking. And now I'm going to turn it over. We're going to talk about each element, and I'm going to call on my co-presenters here. So if we could go to the next slide. And Les, I think you're up next. So you can take yourself off mute. You want to talk about the network of peer support?
Yes, good morning, thank you. We've met and got together, and these groups have come together, as Holly said, and they are really wanting to help. Everybody's dealing with COVID, and I think it brings out a fear, and that takes everybody to their basal ganglion, their primal brain. And as Gina mentioned yesterday in a meeting, that it drops everybody's IQ by 20. So these people have come to these things wanting to help, scared, wanting, sometimes a few angry, sometimes they're balancing fear and freedom, and really from the getting together and just having some discussions has kind of knocked that down a little bit, made things a little bit better, and those that really aren't there have kind of sectioned themselves off. But they're establishing the network. It's coming together in the 18 groups. They're sharing what they have and what they found, and what I think I've seen is larger businesses have more resources. The smaller businesses, they're struggling to stay ahead above water, and they're not necessarily at the meeting or getting to the meeting yet, but they will when they can get there, and we'll have things set up. So the sharing the tools and getting things out, and having plans for them to dive into is great, and it's there when they can get to it or already have it, but it's going to come. The open houses, going back, the exchange of ideas that happen in the open houses or the peer-to-peer meetings really seem to help. And I think going forward, the peers supporting each other is going to really help our community get there. I think 85 to 95% of the people are wanting and helpful. Some of them are still in that angry, scared stage, but hopefully we can get them there and lower our numbers. But this has been a venue that's been positive. I think the PHAB as a whole should trumpet the success of what's going on with WHATCOM Together. Barry, I would encourage the health board or county council, whatever role you're in, to really trumpet what's going on here, because I think that's a big plus that our community may not. We have 139 business members, but I think we can get that out, and it goes back to what Erica said about getting the message out. The group is really doing a good job. The facilitators, Laura, Marty, and Holly, they're amazing. If you've got my personality, I try to convince people with a 2x6, and they've got some magic touches to keep people connected. So that's fabulous. I think there's some great things going on. As far as where we're going right now with what's out there, we're at the end of the beginning of this process to channel my inner Churchill, and we have a lot of work ahead. So this gives some tools to our whole community. So I'm sorry I'm a little long-winded there, but thank you all. You're all amazing.
Hey, thank you, Les. That was great. And I just want to flag that one of this thing about establishing the networks for communication is that here's a sector, it's the movie theater and museum sector. So to ask them, we're in a group, how do you all communicate with other people in your sector? And then everybody joined in and was like, they kind of added all of their own mailing lists, their own email lists together. And then we were able to send out a group, when we sent out the surveys that we did to other folks within that sector in the community. And so now we've established a method, a system by which we can actually reach out to people. So peers connecting throughout the network. This is going to help us not just for this situation, but in the future to communicate with different folks in the community that maybe we haven't been able to before. So I think it's a really, it's going to be a key positive thing for being able to communicate health information. Okay, jumping to the next one. And I think, Sterling, you're up for this next slide, which has to do with how we're getting information out there.
Hi, so can everybody hear me? Yeah. So there are so many places where you can go to get information, from the federal government to the state to local associations. The idea that we could have this locally sourced knowledge, one place to go, is one of the things that we really wanted. There are 18 sectors involved in this, and many of them had never really thought of ever going to the health department or even wanting to have anything to do with the health department. and getting them used to kind of going to the health department, that the health department would be part of the WHATCOM Together piece of this. That's one of the end things that we want. So the idea that we'll have a toolkit with all the guidance sheets and the tips and tools and the signage and all that stuff, and the Whatcom County Health Department webpage, where we want that to be the single source of information for people, where if they really want to know where to go, that's where they should go. Thank you.
Great, thank you, Sterling. Marty, is there anything you want to add to this? Because this is something you've been working a lot on, or Allie?
No, I think it's coming together very nicely. Thank you.
Great. Okay, let's jump on then to the next slide, and this is about the.
So one of the other, So one of the other exciting things to come out of the slide's on. Yep. Okay. So one of the other things that's exciting to come out of this process is a response to some information that we gathered while we were in the process. As Holly noted at the beginning, we were really like, we're going to come out with tip sheets, and that's going to solve all of our COVID problems. But then as we started talking to employers and businesses, suddenly we started hearing kind of a cacophony of things that people really needed. And one of the things that we heard from people was unified signage, that every time you go to a different store, there's a different handwritten sign. Different stores have different rules. Sometimes things look hastily made, and that the other issue was that even when employers put up their own signs, that it seemed like it was just rules that they were imposing rather than it was guidance coming from above, so to speak. And so the campaign kind of was born out of that with a couple of goals. So this is the Safer, Stronger Together campaign to respond to two issues. One, employers wanting unified signage that helped to show their consumer base what they were doing and that they were partnering with the Whatcom County Health Department and essentially working in conjunction to protect their employees as well as to protect the consumers. And this is something that we had a lot of data showing across the nation that consumers needed to see this in order to increase their consumer confidence. Even in places that open, we can see that a lot of people still aren't showing up to stores, even when stores open, because they're not completely sure that stores are working with the health departments and doing everything that they can. And so this is something that reiterates what employers are doing. The second thing that this does is it actually helps to protect employers and employees in situations where you might have people show up who are resistant or aggressive towards some of these social distancing measures. And so this allows employers to be kind of pass the buck slightly and say, like, it's not me doing this to you. These are the rules that we're following, and these rules are coming from above, and we're following the guidelines coming from the state and the health department. And so it really empowers employers and employees. Sometimes I refer to the 16-year-old ice cream scooper who's trying to tell a family that they need to put a mask on and doesn't necessarily feel empowered to do that. This is something that might really help them feel empowered to say, like, look, we've got the signage. This is the health department saying that I have to do this. You know, generally in society, we follow all other kind of health department rules when we go into stores. This is the new one currently. And so the campaign is going to be released in the next over the next week. It was done in coordination with port chambers, downtown business associations, as well as the cities. We have a few outputs from it. There's a large poster that people can use. You can see it down there. And then we even have a decal that can stick to cash registers or stick to a front door. So as people enter businesses, they can see the Safer, Stronger Together decal, which all of this, as well as the mask required poster there, and all of this also feeds to whatcomtogether.org, which is going to be our landing page website, where we really see The first role of this website is obviously for employers to be able to access and get materials and access even online versions of these materials. But we also foresee the website growing in its purpose over time, funneling people towards the main Whatcom County Health Department website and to access information there. And as people are about to talk, we even have ideas around Whatcom Together sessions, so kind of health department led sessions and information sessions that could then be recorded and recordings uploaded to the WHATCOMTogether.org website as well. So kind of a constant resource and an ever evolving resource for our community coming out of this campaign. I think that's all I've got.
Great, thanks. Okay, next slide. Let's wind this up. So what's next? We have presentations to the full task force, PEHAB, all of you, and county council that will want to, that we will be seeing here in the next little while. And then we're going to be launching these Whatcom Together forums. So these will be webinars with task force members sharing tips. It'll, we'll be organizing it with health department staff, of course, while trying not to overstrain everybody's already maxed out schedules. And they'll be recorded and accessed through the WHATCOMTogether.org website. So if you imagine sort of a series where we're helping to reinforce the campaign and also address issues that are on top of mind for people. So what we're planning right now is for the first one to be either July 9th or 10th, and we'll launch the campaign at that time because this is coming up really fast, and then have some peers and folks who are in the task force talk about their own experience and their own tips for how to deal with that interface of the customer and the conversation about masks. And so that's the idea for the first one, and we'll see how it goes. And as always, we'll adjust and make it better. So that's the plan, and I want to turn it over to Gina for our last slide. Gina, it's all yours.
I forgot to unmute myself. So that's the kind of outline of what we've been going through and what we have been developing, and so a couple of ways that we as PEHAB members can help is we can attend the Whatcom Together forums, and I think show of force would obviously support the members who are running it. But I think, again, it goes back to kind of what Greg was talking about earlier this morning. The more we're into this, the more we can share our ideas and we can spread kind of more constructive ways of dealing with what we're facing, and we can share the campaign material. And I have to say, I'm super excited about everything that we are doing so far on this task force, but I think the campaign, the posters that we have right now, that to me is like it's like it's there, like it's quick, it's easy, it's simple, but I also think it's going to be extremely effective, because then business owners don't have to talk about these things. It's just the health department, this is what we're just following rules and orders, and even if people don't necessarily agree, they understand we're all law-abiding citizens, and that's what we're going to do, I think. And so for that reason, it allows the business owners to enforce the rules without having to be confrontational. So I think it's really, really important. So I'm super excited about that. It's very effective. And the next phase of this task force is to present it to the city council. And Barry, you've already seen this, so you're going to see it again. But again, at that meeting, we would love for every single one of you to be there, to be in support of what we're doing and answer questions, because Holly and Marty, they can answer questions, but if we're all there, we can answer questions from the council members in our own way, because we all bring different views or observations. Go ahead, Barry.
Yeah, Holly and I talked a couple of days ago about getting this on the agenda. So I was just went onto our website and looked at our agenda next week. I would prefer to do it next week if we could. If you guys would agree on the 7th, I'll have to shoehorn it in because our agenda is already created. But it would be sometime in the afternoon, sometime probably between 2 and 3:30. I can't promise I can get that done, but I'll start working on it as soon as we get off this meeting and see if we can get that scheduled. And I'll let someone know so they can pass the word. I'll let Holly know. So that sounds doable. If everybody's up to do that next Tuesday, I think it would be appropriate since you want to launch on, just a couple days later. So
That's awesome. Thank you so much, Barry.
Do we need this for the motion that PHAB votes on?
It's just a presentation, so I do not think that we need to vote on it. Tammy, am I right on that?
Yeah, there's no need for a vote.
Okay.
So we're kind of cutting into Kathleen's presentation. I want to make sure that she has enough time because, again, that's another kind of a big whopper that we need to discuss. But are there any questions, comments, anything we want to talk about the task force?
I just wanted to add one thing on top, and I think it's been said, but we've talked a lot about changing the culture around a lot of these interventions and the culture of our county getting involved. And I really think, and I really hope that the county council sees and everyone sees that this task force is doing that exact job. And that this campaign is really focused on doing that job and making sure that we are addressing that culture and the culture of change for everyone to really get involved in participating actively in reducing transmission within our county.
Well said. Okay, so if there aren't any more comments, Kathleen, can I give you the floor to talk about the budget?
Definitely. Thank you, Gina. Let's see, I've got the share screen piece up here. Hold on. Whoops. Okay. Thank you. So I'll go ahead and start off. We've started to work on the budget for this coming year, and maybe I'll just back up a little bit. I think I know everybody, but just in case. So I'm Kathleen Roy, an assistant director at the health department, and I'm working with Erica and the department on the budget, and we are just getting going. And I wanted to introduce also Julia Green. So we just hired Julia Green into the accounting supervisor position just in time for the budget, and so very happy, and she's here with us today. She's joining us. I invited her to sit in as well. And so she is jumping right in and able to assist with the budget, which is great because it's plenty of work. So what I'm going to do today is just share kind of a high level background on the health department's budget and really explain a few things about just how COVID fits in with that. And then review the budget priorities and then also talk about the additional service requests that the department is considering at this time. So what I'm going to do is share my screen so I can show a few slides related to the budget. So I'm just going to pause for a minute while I do that. Okay. Does that work for everyone? Okay, see head nods, great. All right. Okay. whoops, oh, gotta go back, sorry. Okay, so just a little bit of background on the health department's budget. So overall, our budget currently is $22.3 million, and this slide kind of shows how that's split up between the different divisions and the staffing levels of that, with human services being the largest portion of the budget. However, the largest amount of staff is in environmental health, and that's because we do a lot of subcontracting to the local providers in the human services program. With the budget for 2020, which this reflects our 2020 budget, is our base for next year's budget. And then we can submit additional requests if we want. The thing that is kind of unusual this year is just how COVID fits into our regular budget. So our regular budget has not changed this year, even with all the changes with COVID. However, our actual expenses and funding is very different than what we had planned this year. And we're in the very middle of it. And one of the things that is also unique is we have staff from all different divisions working on the COVID response, which kind of falls into C, D, and E if we tried to put it into a division, even though it's really a department-wide response. And in addition, the county has received CARES Act money, and they're managing that $12.5 million across the whole county, and a portion of that is going to the health department. And so that's paying for some of our budget too. So those are kind of where our actual funding and expenses this year would look very different than this split because of COVID. And as we prepare our budget for next year, we will be preparing it kind of along these traditional division lines, and then working in how the county wants us to make the adjustments in terms of the COVID expenses. So that's just kind of a little bit of what we're in the midst of figuring out, but we will still prepare it on a traditional kind of setup. Okay. So the funding sources by division for the county, this kind of just shows that kind of how much funding for the different divisions, with human services being the largest user of the funds, primarily funded a lot by taxes and millage. So revenue coming in, for example, to the behavioral health fund, different things like that help support those community services. Environmental health uses a lot of fees. A lot of these funds are restricted funds for dedicated purposes. Excuse me. Health department uses $2.4 million in general funds, which is flexible funding to kind of fill different gaps. In this, you can see that traditionally community health and communicable disease and epidemiology divisions and admin use more of the general fund monies. With COVID, so this is how our budget is set up, and usually our expenses follow. With COVID, that really the difference in the actuals this year and next year will be somewhat changed too, is that really we have a lot of CARES Act grant funding that is replacing this general funding. So in terms of how it's actually playing out this year, that's one of the changes. And then we have public health assistance is one of the other, and grants that are the other funding sources in the health department. And the grants, a lot of those grants are ones that are coming through the state and they're funding community services. So for example, commerce grants are coming into the human services division, and then they're going back out into the community to support housing support, rental assistance, those kinds of things. And then, so our budget expenses by division, here you can kind of see that our biggest expense really is wages, as in most organizations. The reason it looks kind of different here, with the biggest expense for human services being professional contracts, is because so much of the funding that the human services division receives, a lot of that through grant and dedicated funds through particular funds, is really just going back out into the community in the form of grants to support housing, behavioral health, development and disabilities, really those support services in the community. So I'm going to stop sharing my screen here. So in preparation for the budget, the management team has been meeting and discussing divisional and departmental priorities. As a result of those discussions, we came up with some priorities that I wanted to just share a little bit more explanation. And first one is increasing our community's housing shelter capacity. And this is really about human services has a lot of money coming in from commerce that's available that can really turn around and help support vulnerable populations. And especially in the COVID climate, people who can use it for temporary shelter is really what that funding is for. And so that's one of the priorities, not only just that there's money to support it, but also in terms of the need and how do we support the community and those most impacted in the economic shifting right now. Next priority is increase and expand our COVID-19 crisis response activities. And so that's really about, of course, the COVID response, but building capacity in terms of our case investigations, our contact tracing, our management of isolation and quarantine, people who are in that, daily contacts for that, mitigation of outbreaks, that kind of work. The next priority is enhancing our customer service and efficiency. And what that's really about is bringing on the new EnerGov system, which is really the Environmental Health Division is working closely with other departments in the county as well to really shift into a new software that it will handle permits, among other things, so that individual citizens, residents in the community can do a lot of what they need to do online. And it's, if people have questions about that, John, I'm sure could add a lot more description on that. But it's really, it's due to launch this year. It's going to go forward. And so that's something that's occurring. And then the other priority is to improve health equity in Whatcom County. And that's an important issue identified by multiple divisions. It's been a big part of community health's work. It's been a big part of human services division's work, and shows up in other areas as well. And so that's another priority that was identified. So in terms of the budget process, we will be putting together our budget proposal there, and then we will also have the opportunity to include some additional service requests. And so the ones that we are planning at this point to submit are to increase, request to increase our support to community partners to operate shelters. So we have funding from Commerce to support that, and we would like to take that and turn around and offer that money out into the community. And I think we have maybe about $800,000 potentially that could support that. And then we would like to put in a request for temporary staffing for the COVID-19 crisis response. And so this would be what we're looking at potentially is a full-time position for a program specialist who would be an epidemiologist, and another full-time position for a COVID-19 special projects manager. And this is all stuff we're just in the midst of just pulling together now. So I'm like, where did we end up? It's a lot of discussion to get to this point to really try to coalesce it into what could, because things keep changing so quickly, really identifying what would make a big difference here. And so, and the other thing would be temporary nursing help that it would support as well, and a temporary volunteer coordinator. And so that temporary staffing increase is a request to increase our staffing levels at the health department, and those would be the positions a part of that, and it would be funded by Department of Health or CARES Act epidemiology grant that is coming through Department of Health, but it's federal dollars through the CARES Act, and that's being awarded to the health department through February 2022. And then we're also looking at extended funding through Department of Health and some of those streams to support those positions. And then the third additional service request that we're looking at is increasing staffing for health navigation system. So when we're looking at improving health equity in Whatcom County, what might be something to support that? One of the recommendations that really came out of focus of the Public Health Advisory Board was supporting a health navigation system, and that would be supporting it in the community, but having that it would probably take, it's not necessarily a software system, it's investing in a position to staff that service in the community. And so that's kind of the additional service request that where we're at so far. I think what's helpful is to open it up to discussion to the group, and really what does the health board think about kind of those priorities and additional service requests that you'd like to support. Are there any questions? I kind of ran through a lot of information.
I have something to say about the navigation system, because that's been, we had two task forces, the health protection for immigrant families task force, and then a child and family action plan task force. Both of them just simply said, we really need this kind of thing. And if you ever had a now more than ever thing with COVID, this now more than ever, because we have so many families that do not know what to do not know where to go when they need help. And so I'm really glad to see this, because this is something that the county council and as a health board has approved twice. So really hope this makes it through all the various hoops that it has to go through, so we can get started on this, because we can't wait any longer for that to happen.
So I have one more question. For the COVID-19 crisis response with a lot of these temporary positions, is the money coming from the CARES Act? Or are we requesting just shifting of reallocation of general funding? So can you clarify that, Kathleen?
Sure. So we have CARES Act funding that we're proposing we use for it. We could use that CARES Act funding just to fund our current staff and instead of general funds. And what we're proposing is that we actually use it to invest in additional staffing. And it's CARES Act funding.
Hey, Kathleen, this is Leah.
Hi.
What portion of the 12 million of the CARES Act that was received a while ago went to the Public Health Department?
I don't have the final, so my understanding is that it was 5 million for health, for the COVID health response. The county is administrating that, so it could be, we don't have an exact number how much of that is for our staff and how much is for the health response throughout the county. So we're thinking probably 3.5 to 4 million of that is likely going to cover our staffing costs this past year, our extra staffing costs, or this year, current year. And then there's an additional, I think, 2 million to support community support. And so that money runs through our Human Services Division to get out to the community. I might be a little off on that final number. The county is, it's also supporting, it's supporting like the services related to isolation and quarantine. And so, and there's been a bit of shifting around to make the most of multiple streams of money. But so overall, it's like 7 million that supports the health aspect of the response of that CARES Act money.
Thank you.
Yeah.
I had a question. My apologies. Children are attacking me. So for the temporary staff, I heard you mention a volunteer coordinator. Is this in addition to the current new volunteer coordinator?
No, it's the same thing.
Oh,
so
okay.
So a few of those positions, the coordinator, the nurses,
yeah,
we put on this year, but next year we will have to request it as part of our 2021 budget. It's not a given
Gotcha.
that it carries over from this year until next year.
Gotcha. How many of the new positions that are in that budget are already filled? Or how many of them are going to be new hires, essentially?
So right now we're proposing, we would like to propose 2 new positions that are there's nobody hired, there's no position posted right now.
Okay, and that's the epidemiologist.
And COVID special projects manager.
Okay.
And it could be that as we, because we're also looking at increasing nursing staff, so we might, in addition, look at increasing some nursing staff as a part of that. Some of that is looking at how much for the money, the dedicated money coming in, how many positions could that fund? And so maybe we also would be looking at how much of a nursing position we could fund.
Okay.
Yeah.
And this is Astrid. I would just add and reinforce that the adding additional nursing staff for COVID related things is critical. We have so many things that are going undone. You know, the sexually transmitted disease pile is increasing, and all the regular daily work that that we were doing before COVID didn't go away. It's just been on the back burner as staff have been. And I just want to really acknowledge all the staff, but especially, I mean, the nurses are just so critical at this point during this process. So having additional nursing staff to help take the load off and also help us get back to other work is critical.
So I'm about to ask a question, and if this is not the place to ask, then please just say this is not the place. I understand that some of a lot of the employees at the health department are asked to take furloughs for different periods of time, like 5 days, or so many hours. Is there any way that we could use the CARES money to supplement that so that they wouldn't have to? Because if we're needing more nurses and more staff to do the work, then I don't understand why, kind of furloughing the employees when we have all these work to do. I mean, does that make sense?
Erica, do you want to speak to that, or do you want me to?
If you want to speak to the financial piece, I can speak to the sort of policy piece.
Okay. So, so Tina, your question is why are we hiring new staff when there's furloughs going into place?
Yes, and could we use the money from CARES Act to supplement so that we're not furloughing people who are already in place?
Okay. So,
Kathleen, if you want me to start, that's okay. It's a hard issue for our department. So one of the largest represented groups in the entire county voted as, and this represents all different departments in the county, so not just the health department. This is the master's agreement with the Teamsters. I don't know how many there are countywide, but there was a vote of all of those members, not just health department members, to furlough 4 days in July and August. And the impact that has on the health department, we don't know what will happen with our other 2 represented unions, which are the Washington State Nurses Association and the IFPTE Local 17, which represents our environmental health staff primarily. We don't know what the outcome of that will be, but the impact on our staff just that are in the masters. I think, for example, so Melissa Moran, our communications person, is in the masters. Our emergency preparedness program specialist, who is helping to lead this effort, is in the masters. The clerks that are doing data entry and helping with specimen labeling and collection are in this union. So this will have impacts on our operations this summer. I can tell you that in the last 4.5 months, staff have been on average able to take a total of 6 hours of vacation leave, and they are being asked in half that amount of time to take 4 times that many hours of leave. We recognize that staff need to take time off, setting limitations even as we're seeing increased cases. Like I said, our worst week ever last week will have impacts on our operations, and we are trying to work through how to balance that and how to not fall further behind in our efforts in this area. But it will be incredibly challenging, especially given the time limitations by which people can take those furlough hours. We recognize that the county has an overall challenge in the budget, and some of these agreements are county-wide rather than sort of piecemeal based on equity and need in different positions, and that's sort of a bigger challenge than just the health department. But there will be impacts. There will be impacts in a lot of ways.
I have a question. Is there anything that PHAB can do about this as a Public Health Advisory Board? Because this is, I'm trying to think of the right word. This is dumb. And that the health department that we depend on to do all these things, and they're being asked to do more all the time. Is there anybody that we can influence or twist their arm? What can we do to help with this? Who do we talk to?
I'm not sure, and I wonder, Barry, because
Barry,
you serve on the county council, if maybe you have thoughts to share or additional information.
Yeah, I certainly don't have any additional information, but this is that's a very serious question on how we deal with this with the bargaining units, and that's kind of out of the council's league in terms of those agreements and how they're negotiated. So there's kind of an element between the council and this issue that we have to figure out how to address. And we're still formulating the council budget priorities now. Those priorities that we're working on now are for 21 and 22, but I think the discussion is certainly relevant to bring it back to 2020 and what we need to do to get the work done that we need to during this really a crunch time in this pandemic. So I'm working on it. Again, there's just some things that are out of reach for the council in terms of agreements, labor agreements. But I'm trying to find some sort of an avenue if there is one, and definitely I'm working on it. So that's about the only update I can give.
I didn't mean to put you on the spot, Barry, but I think this is bigger and more complex than just the health department. It's, yeah, so that's where we are at this point.
Go ahead, Sterling. No?
I'm good. I just wanted to maybe vent a little bit about that and find out if there's anything that we could do. We'll have to see what happens. I hope that this doesn't make things worse for the health department's mandates and how important it is. This is all. Thanks.
Well, Barry, is there anything that we as PHAB can do to kind of help support you?
I would suggest there's always something the members of PHAB can do, guaranteed. And I think the one thing now is to put your concerns into an email, send it to the county executive, send it to Deputy Executive Schroeder, and to the whole council. on your concerns. I think they're super valid concerns. It is kind of an absurd concept that we're up against, but that's where we are. But that's what I would suggest: is contact the executive, the deputy executive, and the council, and make your concerns known.
Okay, well, thank you. Thank you for doing that. Maybe the PHAB members, Lindsay, Leah, Steve, who else is here? Lee, Sterling. So maybe we can all get together and form a letter that we can send out to those 3 entities that the Barry talked about. So Barry can, push for the right ideas, and we can help support the health department and the bigger picture of health of our community. So we are at 8:30, and I was really hoping that we could have like 2 minutes to just talk about like just 2-liners for the last 5, 6, and 7 items. But I think we're going to have to ask Tammy to send emails to the PHAB members to come up with a date and time for a special meeting to discuss those 3 items. Is that agreeable to everyone? Yes. Lindsay, Leah, Steve? Okay, perfect. Okay, so then I don't think I saw any public comments on the chat box. Oh, hi, Nick, go ahead.
Hi, I'm actually with the Western Front as a reporter. I was just wondering if I could ask maybe a couple of you some questions real quickly. They wouldn't be long. Or if there's a good place to send questions for.
There actually is it's a JIC Joint Information Center for your questions. That way we can actually answer your question in full rather than just the 2-second snippets. And that is WUC_JIC at co.whatcom.wa.us. And I think Tammy can probably put that in the chat box so that you can have the correct email in case I didn't spell it out right.
Perfect, thank you.
It's in the chat box.
Okay, perfect. Okay, so any other questions, comments that we need to urgently discuss at 8:32? No? Okay. Well, I want to thank everyone for coming. 7 o'clock morning meetings are not exactly everyone's favorite, but so many of you guys show up every single time we have these things, and thank you so much. And for everyone who is working super hard at the health department, I mean, with all your energy and creativity and your heart and emotions that's going into this, I just want to thank you guys all. I don't think I can say that enough, but thank you. And until our next meeting, I will say adieu. The meeting is over.